the Ebola outbreak will not be removed from the human population within the order of, say, weeks or months. That's what's happened in previous outbreaks. Now, we know that this outbreak is far bigger, and it is going to take longer. But what we expect to happen if all the control measures are put in place is that on the order of weeks or a few months from now, Ebola will disappear from the human population.
The numbers are staggering. The potential that Ebola could affect more than 1 million people in North Africa by the time 2015 arrives. Despite the fact there are other concerns around the globe, this is something that won't just go away. And now there are words like experimental drugs and airborne transmission being tossed about. So the need here is to get some real fact behind all the hype. Of course, it's something we do every single day. Let's welcome to MidPoint the former Lieutenant Governor for the state of New York and a leading activist in healthcare who's been at the forefront of fighting for healthcare reform for many years. Betsy McCaughey joins us. Betsy, pleasure to see you again. Thanks for joining us.
Well, thank you. And the figures that came from both the Centers for Disease Control and Prevention, CDC, and the World Health Organization yesterday are distressing. They indicate that the outbreak currently engulfing 3 countries, Sierra Leone, Guinea, and Liberia, in Western Africa, will be 100 times bigger by January. The other very distressing prediction is that the scientists have found that now 70% of people infected with this virus are dying, as opposed to earlier reports that said 50%. But what I find particularly distressing is this. The Obama administration recently pledged $750 million to help curtail the epidemic, but they're pouring it all into one country, Liberia. They're playing favorites. Liberia is the president's favorite because his buddy, Ellen Johnson Sirleaf, is the president there. But the science shows, Ed, that if these tax dollars were spent differently, if these tax dollars were spent preparing the surrounding countries that are on the future path of Ebola to prevent a big outbreak, the money would save many more lives. And Ebola is going to hit those countries. Oxford University researchers have recently reported that the migration of fruit bats, a flying mammal indigenous to the region, will likely carry this virus to 15 more countries this year. So we need to be spending those dollars not simply treating the infected, but also containing future outbreaks in other countries, especially countries that have very large cities.
Is it not fair to say, though, and you brought up a fact that what the president's doing in certain cities, but is it not fair to say, Betsy, that Liberia is the strongest hit at this moment because you had a Doctors Without Borders staff member who basically got infected there as well. You have Sierra Leone who's there, but there's many people saying that Liberia is one of the key points right now that must be contained.
Well, Liberia, Sierra Leone, and Guinea were all very hard hit. Guinea may be the hardest hit of all. But the fact is, what the science shows is that just treating the people in these countries that are currently overwhelmed with the disease won't save the most lives. We have to move ahead of the disease and prepare the countries that are likely on the path next. And it's not just the fruit bats that are going to carry the disease to these other countries. Sadly enough, commercial air traffic is also a big problem. And the scientists are warning that flights out of these 3 affected countries should be halted. British Airways and Air France have already done that. And scientists at Northeastern University have done a computer assessment of how this commercial air traffic is going to carry this virus to other African countries.
Certainly. And
to the UK. The risk to the US is much smaller. But here's an example of how deadly that can be. Patrick Sawyer, one man, one traveler, infected with Ebola because he attended his sister's funeral and she had Ebola, traveled to Lagos, Nigeria, and he infected 21 other people in Nigeria, 8 of whom died, mostly doctors and nurses, before he himself died as well. So
isn't
it's
it always
only
important,
because
though,
Nigeria,
and I agree with you, but isn't it important also to get to the core of what's going on? We do have to stop it around the world, but you've got to stop it where it is. You mentioned the 3 countries, fair to say, but you've really got to focus on that, because now we're also hearing that there possibly could be, you mentioned, of course, other countries, but we have to look towards America as well, because we're hearing the words like experimental drugs and airborne transmission that are sitting in here as well. So you do have to focus down and at least stop where it begins, correct?
yes, but don't forget, this virus didn't begin in West Africa. It was the first case in West Africa appears to have been transmitted from a fruit bat to a 2-year-old. But what allowed it to spread in West Africa was travel among the 3 countries, people attending funerals from Sierra Leone and Liberia, visited Guinea, and then brought the disease home. So the scientists, if you listen to the scientists, Ed, instead of the politicians, you will find out that there are practical steps that are highly effective in containing this.
All right, now let's talk about
the travel.
Let's talk about the practical steps here. Here's the United Nations Secretary General Chief, Ban Ki-moon. He was talking about the importance of certain countries going after it, and he has a warning. Here, listen up.
Bans on travel or transport will not keep Ebola from getting out, but will keep medical personnel and supplies from getting in. We need to isolate people affected by Ebola, but not the nations struggling to cope with it.
Isn't it fair to say that we need to isolate some of these countries at this point? And simply put, that's been done in the last couple of weeks. To take these countries, I know how hard it is to sound like, but basically put a ring around certain countries, that's where they're starting, and you have to stop it there.
Well, that's right. And the top executives at the World Health Organization and, unfortunately, our own CDC have said, don't cancel the flights. But in fact, it's okay to let those flights in, but make them leave those countries empty, because we can't allow the virus to be carried out of those countries. That is critically important, and Patrick Sawyer is a perfect example of that. One infected air traveler can spark an epidemic in a country that's not ready for it.
Then let's look at 2 things here, a few minutes that we have left. First of all, I mentioned earlier experimental drugs. The vaccine developer Inovio says they and their partners are going to start using an experimental Ebola vaccine in humans in the first half of 2015. Don't we need to see more of these? Take the chance at this point, as rampant as this drug can be. If you've got something that has a shot at it, at least give it the shot.
Of course we should, but let me point out that none of these companies currently has the capacity to produce enough doses to actually stop this epidemic. Of course, drug development for the future is critically important, but right now what we're left with is good infection control and smart preparation, Ed, for the countries that have not yet been hit by this virus, because they will be hit. Not only because of commercial air traffic, which should be halted, but because of nature. We can't stop the bats, and in fact, that is how Ebola has traveled across the continent of Africa in previous years. We know other countries will be hit with this virus, and we have to get ahead of it and prepare them so that we don't see this kind of slaughter again.
Which countries' air traffic would you shut down, Betsy?
Well, certainly the 3 that are engulfed in the epidemic
Guinea,
right
Sierra
now,
Leone, and Liberia.
Guinea, and Sierra Leone. And many carriers, in addition to the 2 I mentioned, have already done that. But preposterously, the CDC has told American carriers to outfit flight attendants with goggles, masks, and full protective clothing in the event someone on the plane gets sick, and to treat all body fluids as infectious. I don't think so.
All right. Now, do you also then agree or disagree with the CDC? They estimate that if 70% of people with Ebola are properly cared for in medical facilities, the epidemic could decrease and eventually end. Yes or no?
Well, I hope they're right about that. I truly hope they're right. Unfortunately, the medical facilities are spread so thin right now. Even the president's proposal for Liberia, 1,700 hospital beds. According to the projections, by November, December, that'll just be 1 day's worth of newly infected cases.
Let me ask you this final question. I mentioned the 2 words airborne transmission earlier. We talked about it earlier this week right here on MidPoint. Do you think that that is a valid concern at this time?
I think it's overemphasized for two reasons. One, we've already seen this virus mutate over 300 times, and that hasn't happened. But more importantly, this, Ed, there are many infectious diseases that kill thousands, hundreds of thousands of people, and they're not airborne. Look at our own hospitals, C. diff, MRSA, VRE, CRE. None of these nasty infections is airborne.
So then again, don't necessarily worry about it.
So a disease, a virus or a bacterium can wreak havoc and kill thousands without being airborne.
Okay, there you go. We'll make that the last word this time around. So much to cover, as a matter of fact. Betsy McCaughey, your insights always appreciated. Thank you so much, and stay healthy.
Thank you.
All right, later on this hour, America and the world have been introduced to a not-so-new band of terrorist killers who deserve to be targeted and removed before they strike again. That's the focus. Coruscant in News Call.